My name is Antonia Salas, and today I will be discussing schizophrenia. What is schizophrenia? Schizophrenia is a chronic and severe mental disorder that affects how a person thinks, feels, and behaves. Hallucinations, delusions, hostility, insomnia, and disorganized speech are just a few symptoms to look out for. Diagnosis, according to the DSM-5, shows the following in order to be diagnosed with schizophrenia. The individual or individuals would need to have two or more of the following for at least 1 month or longer: delusions, hallucinations, disorganized speech, catatonic behavior, diminished emotional expression. Schizoaffective disorder and bipolar or depressive disorder with psychotic features have been ruled out in regards to diagnosis of schizophrenia. Let's include this note. Associated features such as phobias, lack of sleep, detachment, hostility, and a few others contributes to the diagnosis of schizophrenia. Neurotransmitters. There's a connection between neurotransmitters and schizophrenia because drugs that alter the levels of neurotransmitters in the brain are known to relieve some of the symptoms of schizophrenia. Research suggests schizophrenia may be caused by a change in the level of two neurotransmitters, which are dopamine and serotonin. Some studies indicate an imbalance between the two may be the basis of the problem. Others have found a change in the body's sensitivity to the neurotransmitters as part of the cause of schizophrenia. Treatment for schizophrenia. Now, mind you, schizophrenia is an actual disorder, so it could be long term or temporarily. So let's get into the treatment for schizophrenia. Treatment options include the following: medication, psychological counseling with a psychologist, and self help resources. Let's note this: a psychiatrist experienced in treating schizophrenia usually guides treatment, which means that a full team approach is usually used on patient or patients with schizophrenia, which includes a social worker, psychologist, psychiatric nurse, and sometimes case managers. These are the 6 most common medications for schizophrenia: Risperdal, Zyprexa, Seroquel, Geodin, Clozaril, and haloperidol. Treatment options will determine the length of treatment. Schizophrenia is a disorder occurring in the brain, of course, affecting other parts of the body. So it can affect the liver, the way a person walks, or mainly their speech, actually. Mainly their speech is what is affected, but other research indicates schizophrenia affects other parts of the body. So basically, what I concluded is that schizophrenia is a long term disorder. And with treatment, a person can actually lead a normal life. So, here are some interesting facts on schizophrenia I researched. According to the American Psychiatric Association, schizophrenia is a chronic brain disorder that affects less than 1% of the US population. As of now, the causes of schizophrenia are not known. However, it is considered an polygenetic disorder, which means that schizophrenia has many different causes. Symptoms of this disorder include hallucination, delusions, challenges with thinking and concentrating. Also, a lack of motivation, including impaired cognition and disorganization or abnormal movements. There are often misconceptions in regards to schizophrenia. Most people dealing with this disorder are not violent or dangerous. Most people dealing with schizophrenia may live with family in group homes or living on their own. Psychedelic drugs can cause hallucinations. LSD and other drugs were first proposed to be involved in analytic disorders seen in schizophrenia. According to the text, it was hypothesized that 5-H2 receptor antagonism might be responsible for some of the beneficial actions of antipsychotics. Even though it has been determined that serotonin does not play a major role in the analysis of schizophrenia, antagonism of serotonin at 5-H2 receptors may be beneficial in the improvement of the neurological side effect profile of the newer edition of the antipsychotic medications. Here are my references, and I hope you enjoyed the presentation.